Did you know that itching in certain areas of your body could be a quiet signal of cancer? Most people shrug off an occasional itch. But for older adults, especially those over 60, persistent itching in specific spots may be more than just dry skin or irritation. It might be your body sending a warning you shouldn't ignore. In this video, we're going to reveal 5 distinct places on the body where unexplained itching could point to cancer, sometimes even months before any other signs appear. These aren't random itchy spots. They follow patterns doctors have seen again and again in patients later diagnosed with serious conditions like lymphoma, pancreatic cancer, breast cancer, and skin cancer. Stick with me to the end, because we're not just naming body parts. You'll understand why these areas itch, what kinds of cancer they're connected to, and how to tell the difference between a harmless skin irritation and a deeper issue. By the end, you'll know what to watch for, what to ask your doctor, and what steps to take, if any of this feels familiar. And most importantly, this video isn't meant to scare you. It's to help you stay aware. Because the earlier you notice these subtle warning signs, the better your chances of catching something before it becomes harder to treat. Let's get into it. Sign number 1, itching between the shoulder blades or upper back. There's a particular kind of itch that shows up deep in the upper back, right between the shoulder blades. It's easy to dismiss. Maybe you blame it on poor posture, dry air, or an old shirt tag. But for some older adults, constant itching in this exact spot, especially when it feels like it's coming from beneath the skin, has been linked to pancreatic cancer. It might seem strange. How could the pancreas, buried deep in your abdomen, cause itching way up on your back? Here's how it works. When a tumor starts forming in the pancreas, it can block the bile ducts, the small tubes that move bile from your liver into your intestines. When that flow is disrupted, bile salts build up in the bloodstream. And one of the earliest effects of that build-up? Irritation of the nerve endings, often in places like the upper back, where there's a dense web of sensory nerves. I remember a woman named Joy. She was 69. She described a weird, phantom itch in her upper back that kept waking her at night. She tried everything, lotions, back scratchers, even got a new mattress, but nothing worked. She said it felt like the itch was inside her, not on the skin. Eventually, she went for blood tests because of unexplained fatigue. That's when doctors noticed her liver enzymes were elevated. Further scans showed a small tumor in her pancreas, pressing on her bile duct. The shocking part? That deep itch was her only real symptom. No pain, no yellow skin, just that persistent, gnawing itch. And she only caught it early because she trusted her instincts and spoke up, even when it felt like a small thing. That's why this location matters. Sure, general back itchiness can happen from dry skin, heat, or friction. But when the itch is specific, persistent, and doesn't respond to creams or treatment, it's worth paying attention, especially if it's paired with other subtle symptoms like dark urine, pale-colored stool, or tiredness. That back itch might actually be your body raising a flag for something going wrong deep inside. For older adults, it's easy to brush things off. You don't want to sound dramatic, but your body knows what it's doing. If it keeps nudging you with the same signal, even if it's just an itch, it's time to listen. If you're still watching and finding this helpful, drop a 1 in the comments to let me know you're here. And if you haven't already, please subscribe and hit the notification bell so you don't miss more content like this. Your support truly helps us keep creating videos to inform, protect, and empower you. Let's move on. Sign 2. Persistent itching on the lower legs. When older adults start noticing a constant itch on their lower legs, especially on the shins and calves, and there's no rash, no dryness, and no new soap or lotion to blame, it's easy to assume it's just aging skin. But this exact symptom has been quietly present in many people later diagnosed with blood cancers, particularly lymphoma. This isn't the kind of itch that comes and goes. It sticks around. It often intensifies at night, and unlike dry skin, it doesn't respond to lotion. The reason lies in how certain cancers, like Hodgkin's lymphoma, interfere with the immune system. These types of cancer begin in the lymphatic system, the body's key defense and drainage network. As cancer cells multiply, they release inflammatory substances into the bloodstream. These substances can irritate nerves under the skin, and one of the most common results is a deep, burning itch, often felt in the lower limbs. The skin might look perfectly normal, but under the surface the nerves are reacting to something much bigger. Take the story of Mr. Brown, age 77. He spoke during a cancer awareness event and shared how his only symptom for nearly half a year was a relentless itch on the front of his legs. His doctor first suspected eczema, or maybe a reaction to his laundry detergent. But when blood work showed elevated white cells and imaging revealed swollen lymph nodes in his chest, the real diagnosis came into focus: lymphoma. He said something powerful. The itch came first, long before I knew anything else was wrong. And stories like his, they aren't unusual. Not every leg itch means cancer, of course. But if the itch is persistent, unexplained, and doesn't go away with regular creams, it's worth digging deeper, especially if it's accompanied by quiet warning signs like night sweats, fatigue, or unintended weight loss. As we age, our bodies can become more subtle in how they communicate distress. You might not feel pain. Lumps might be hidden too deep to notice. But the nerves still respond, and an itch can be that first reaction. So if you, or someone close to you, has been scratching their legs nightly, trying cream after cream without relief, don't dismiss it. Ask for blood tests. Mention the pattern to your doctor, because sometimes the body whispers before it screams, and catching those whispers early can change everything. Sign 3. Itchy scalp without flakes or redness. An itchy scalp doesn't usually raise alarm bells. Most older adults chalk it up to dry air, aging skin, or maybe a shampoo that's a little too harsh. But when the itching becomes constant, and there's no dandruff, no flaking, and no visible irritation, it might point to something more serious beneath the surface, including blood cancers like leukemia, or even skin cancer on the scalp. What makes this itch different is the way it feels. It's less like dryness, and more like a tingling, crawling, or burning sensation. It might move from one spot to another, And it often doesn't get better with typical scalp treatments, not even anti-dandruff shampoos or oils. For people over 60, this can be a sign of nerve irritation caused by abnormal immune activity, something that can happen when leukemia cells multiply and start interfering with how the body manages inflammation. There's a man named Mike, 74, who shared his experience. His scalp started itching every afternoon. At first, he thought it was a new shampoo, or maybe his favorite hat. He switched products, tried different soaps, but the sensation stayed. Ideally, by a dermatologist under proper lighting. Since the scalp isn't easy to examine on your own, it's smart to ask a spouse, caregiver, or even a hairdresser to look regularly. If you're feeling an itch that won't go away, and it's not reacting to anything you try, that's a signal worth listening to, especially if it's accompanied by unexplained fatigue, easy bruising, or just that vague feeling that something's not quite right. It might seem small, but sometimes it's the small, persistent signs that hold the biggest clues. But here's the difference. A cancer-related itch doesn't respond to anything. No shampoo, no cream, no treatment. It lingers. It nags. And it often feels completely disconnected from any visible issue. And while leukemia is one possibility, skin cancers that form on the scalp, especially in areas where the hair is thinning, can also begin with nothing more than a small, itchy spot. It might look like a bit of dry skin or a bump, but if it stays itchy, especially in the same location, and doesn't heal, it needs to be checked out. Sign 4. Localized itching on the chest or breast area. When older adults, especially women but also men, experience a persistent itch on the chest or breast area, it's often chalked up to sweat, a tight shirt, or age-related skin changes. But this region is one of the most commonly overlooked spots where itching could point to something far more serious, including inflammatory breast cancer or tumors near the chest wall. What makes this type of itching unique is that it often appears before any lump can be felt. The skin might seem warmer, slightly irritated, or tight. Sometimes it becomes rougher, thicker, or takes on a reddish tint. But in many cases, there's no visible change, only that deep, unrelenting itch that won't go away, no matter what product you try. I remember a woman named Rose, age 70. She began feeling an itch around her right breast. She thought it was her bra, switched brands, switched detergents, even stopped wearing one for a while, assuming it was just friction. But the itch stuck around. Same spot, every single day. Finally, she scheduled a checkup. Her doctor noticed slight dimpling of the skin and ordered more tests. The results? A small but aggressive tumor growing near the surface of the breast, without the classic lump most people associate with breast cancer. That's what makes inflammatory breast cancer so dangerous. It doesn't always play by the rules. It can mimic a rash, spread quickly, and the first symptom is often not pain, but itching. This is why it's so important to pay attention to localized itching, the kind that stays in one place, doesn't respond to lotion, and persists day after day, especially in the breast or chest region. And for men, this can be even easier to miss. We don't always expect breast cancer in men, but it happens. And without the awareness, that warning itch is even more likely to go unnoticed. Male breast cancer may be rare, but it does happen. And it often slips under the radar because the symptoms don't match what most men expect. An itchy spot near the nipple, a small patch of thickened skin, or even a subtle sense of discomfort under the chest muscle might not seem alarming. But for men in their 60s, 70s, or 80s, these quiet signs deserve closer attention. And it's not always about cancer in the breast itself. Itching in this region can also be triggered by swollen lymph nodes under the arms or below the collarbone, early indicators of lymphoma or another nearby cancer. So if that itch is paired with swelling, warmth, or a sense of heaviness in the area, don't wait. Early detection doesn't start with machines. It starts with awareness, with paying attention, with recognizing when something doesn't feel quite right. Because your skin doesn't speak, but it does signal. And this is one of the most important signals not to ignore. If you're still watching and finding this information helpful, go ahead and comment 4 below to let me know you're here. And if you haven't yet, please subscribe and turn on the notification bell so you don't miss any of our future videos. Your support helps us keep creating content that informs and empowers. Let's move on. Sign 5. Persistent itching in the anal or genital area. Few things are more uncomfortable or more often brushed aside than itching in the anal or genital region. It's a sensitive topic, especially for older adults, and many would rather ignore it than bring it up. But when this kind of itching becomes chronic and there's no clear cause, like poor hygiene, an infection, or surface irritation, it may be your body waving a red flag. In some cases, persistent itch in this region can be an early symptom of anal cancer, vulvar cancer, or even penile cancer. What makes it tricky is how easily disguised it can be. People assume it's just dry skin, a reaction to toilet paper, some rubbing from walking, or an effect of incontinence pads. And sometimes it is. But if the itch persists for weeks or months, keeps coming back, and starts to feel raw or burning rather than just surface level, it needs medical attention. Take the story of Thomas, 78. He'd been dealing with what he assumed was hemorrhoid-related itching for nearly a year. He tried creams, changed his diet, even applied cold compresses. But the irritation never truly stopped. Finally, he saw a colorectal specialist. A scope revealed a small lesion on his anal canal wall, an early-stage tumor that could have grown silently had he not trusted his gut and sought a second opinion. The same warning applies to women. Vulvar cancer is rare, but the risk increases after age 60. One of its first signs, a recurring itch near the outer genital area. There may be no noticeable lump, but the skin may begin to feel thinner, rougher, or take on a slightly different color. Many women assume it's just hormonal changes or postmenopausal dryness. And often, that's the case. But if the itching is intense, persistent, especially worse at night, and doesn't respond to typical treatments, it shouldn't be dismissed. This region is packed with nerve endings. It's incredibly sensitive, which means it can detect internal changes early, whether it's shifts in skin cell behavior, nerve inflammation, or swelling in nearby lymph nodes. If the itching is only on one side or focused in one small area, it's even more reason to pay attention. The problem? Most people stay silent. They worry they'll seem dramatic, or they feel too embarrassed to bring it up. But silence is far riskier than speaking up. Bringing attention to an itch might feel small, but it can lead to early diagnosis, better treatment outcomes, and, most importantly, peace of mind. The takeaway: if it doesn't go away, don't assume it's nothing. Let a healthcare professional take a closer look. Because catching something early, even something as serious as cancer, often starts with recognizing the small things, the quiet signals, and making the choice not to ignore them. Final thoughts. As we wrap up this video, I want to leave you with one simple truth. Your body is always trying to tell you something. Sometimes it speaks through pain, sometimes through exhaustion, but often it starts with something subtle, something so small it's easy to miss, like an itch that keeps showing up in the same place, no matter what you do. The 5 areas we explored today, the lower legs, upper back, scalp, chest, and genital region, they aren't random. These are common spots where internal problems, including certain cancers, often send their first early warning signs. And for older adults, learning to notice those signs could mean the difference between catching something in time and letting it grow in silence. This video isn't about fear, it's about awareness, about empowerment. It's a reminder that your body knows when something isn't right, and that your instincts do matter. What may feel like a minor nuisance could be your body quietly asking for help. So if any of these signs felt familiar to you, don't ignore them. Talk to your doctor. Start that conversation. You deserve clarity. You deserve peace of mind. Thank you so much for spending time with us today. We'd love to hear from you. Drop a comment below and share one thing you learned, or how you plan to use this knowledge in your life. Your voice matters to us, and your comments give us the motivation to keep creating content that supports and informs. And if you found this video helpful, please remember to like, subscribe, and share it with someone who might need it.